This is an introduction to BiPAP video intended for nurses caring for patients on comfort care presented by the Methodist Hospital Respiratory Care Department. BiPAP consists of a continuous pressure like a CPAP called EPAP on a vision, but has a larger pressure that kicks in during inhalation to actively assist with breathing, referred to as IPAP on a vision. The default screen on the BiPAP shows you most things you'd likely need to document, such as IPAP, EPAP, patient's respiratory rate, which is right there, and the FiO2. At the top of the screen or display is the alarm message board. There are several different alarm messages. However, almost all alarms are the result of a mask leak or circuit disconnect. Should the BiPAP have become disconnected, either right here or at the mask, right here would be a common place, simply reconnect it. Otherwise, in troubleshooting the alarms, generally it would be a mask leak, and just take your hand and go around the mask as such, and if you feel a leak, say right here, adjust the strap a little tighter corresponding to the leak. One more method of fixing a mask leak is to pull the mask up off the patient's face and gently set it back down again. Sometimes that will seal the leak without making the mask any tighter than it already is. The only other common cause of an alarm is the proximal line disconnect. That message can be seen up there, and it is this little tube that comes disconnected. This tube goes either to the other end of the tubing, sometimes it would be connected to the mask. Now we have an audible alarm, and we can see the alarm message there, proximal line disconnect. And we reconnect it, and the audible alarm goes away because we have fixed the problem. It should be noted that an audible alarm means something is wrong at that moment. A visual alarm without an audible alarm indicates that there was a problem which has now been resolved. No action is necessary for this. However, if you wish, you may clear the alarm message board by pressing the alarm cancel button, which is here, and you'll notice these go away. Now we'll go over using the standby function and removing the mask. Remove the mask from the patient by pressing the quick release. There is no need to undo Velcro straps. Then press standby, which is right here. When the patient is ready to use the BiPAP again, place the mask on the patient with the machine still in standby mode. The machine will automatically restart working again. Right this way. Note that the straps should not require adjusting, although there may be times when they will. Lastly, we'll address powering the machine off. To turn the machine off completely, press the white button located at the rear of the machine. The white button is right here. And the machine is off. To turn the machine on, press the same white button. At this point, the machine will do a self-test. System self-test in progress. At the end of which it will tell you to press the monitoring button. Right here it says press monitoring to exit. You can press that, and it is safe to apply the mask to the patient. It would be best, if you're uncomfortable with this step, to page your respiratory therapist for the initial startup. It is important to note that you should only start up a BiPAP and put it on a patient if you know that BiPAP has already been used for that specific patient, so that the settings will be appropriate for your patient. Always feel free to page a respiratory therapist with any questions or concerns you may have regarding a BiPAP.